I am Yona Lunsky from the Azrieli Centre here at CAMH, and I'm excited to be back with one of my favorite family doctors, Ullanda Niel. You want to introduce
Hi.
yourself?
Hi, I'm Ullanda Niel. I'm a family doctor. I see patients with intellectual disabilities at my community health center in Scarborough and also at Participation House in Markham. And I'm happy to be here.
Yeah, this
This
is
is my third time doing this. So I'm rolling through the season. So now I'm trying to get a little more of a fall motif.
yes. Yes, we need to have like some autumn leaves behind us, you know. But it is an important time for us to be coming back, I think, to some questions that might be the same questions, although the science and the information we have now is a little different, as well as some new emerging questions, I think, as we have our emerging Delta and our, emerging very vaccinated population, things opening back up, what it means, all kinds of issues, I think, that people with disabilities and families want to know about. So I'll interview you, but sometimes you can interview me, and let's interrupt each other as we go and try to get to the bottom of some tricky questions for people. So, most of the staff who work in the developmental sector are women. And there are issues that I think women have about the vaccine. There's women who are worried about what it might do for their periods, women who are worried about what happens if they're pregnant, if they want to nurse, if they are pregnant already, and it makes them really afraid to have to put a vaccine in their body when they've managed so far working, during the whole pandemic, and they've never had COVID, right? So what kind of conversations do you have with women who are pregnant or who want to get pregnant about the vaccine with what we know now?
So for me, this was personally a really important topic. When early in the pandemic, I was pregnant and I had to make a big decision about whether or not to receive the COVID-19 vaccine. And at that time, there was very little information, but after reviewing the potential risks from the studies that have already been done and what could possibly happen just with the technology of the medication, I felt like it was much safer to go ahead with the vaccine than to get COVID-19 personally. Being pregnant and having COVID-19 is truly terrible, very high risk of severe disease. And it puts your baby at risk as well, because you may end up, having to be in the hospital or having baby early. So I felt like it was important for me to get the vaccine, and I did. And to be fair, at that time, that was kind of an experimental thing to do. But now things have changed. There's been a lot of pregnant women who've received the vaccine, and we have quite a bit of information. And the medical societies are starting to say and strongly recommend that pregnant women get the vaccine. So things have pivoted, and it's no longer just an experiment, but a recommendation, and a strong one at that. So personally, I was happy that I got the vaccine. I got one dose prior to having my baby and one dose while I was nursing. And, for me, things went really well. And I see that a lot of the data is showing that things have been really good for other women who've had babies in the past year who've received the vaccine. So there's that side. I have heard about people wondering about their fertility. There's no evidence that the vaccine affects your fertility. There have been some reports here and there about the vaccine affecting your period, like maybe having a heavy period or a change in your period after receiving a dose of the vaccine. And there's no clear reason why that might happen. It's still, people are looking into it and thinking about it. I know it's an important question, but there's no proof that it's going to have any kind of long-term effect on your fertility. So I think it's worth going ahead with the vaccine. The last thing you want to do is be pregnant and contract COVID-19.
Yeah, I think we thought that might be an issue early on, but sadly, it looks like the more COVID we've had, the more we've seen in terms of what happens to women when they are pregnant. So I
Yeah,
think
yeah, and
definitely.
it's just you know, the stories are truly heartbreaking, so it's very important. Yeah.
And also it may make a difference, is there COVID in the community or not? So maybe at a certain point in the pandemic, there wasn't a lot of COVID, and it wasn't as much of a worry or a risk. But certainly right now we're in a situation where our rates are going up and Delta spreads really easily, especially
Mhm.
amongst people who haven't had a vaccine. So, it's like a greater possibility that someone could contract COVID if they're
Yeah,
not
and thinking
vaccinated.
about your risk, right? So, um, for a lot of women who are pregnant, they may have other young children in the household who are not able to be vaccinated because they're less than the age of 12, right? So they're potential carriers of COVID-19, and also, um, you know, if we're talking about people that work who were developmental service workers, um, they are in contact with the public and are frontline workers. So they are at higher risk. We also know that people who live in certain areas are more likely to contract COVID-19. So thinking about what's happening, what your numbers are like in your neighborhood, in your area. Um, so yeah, if you are a person that's at higher risk, it's really worth starting to think about it, getting that conversation going with your family doctor or your obstetrician or the person who's going to deliver your baby, because they might have some really good advice for you.
Thank you. Yeah, it's a big question, I think, for people. So again, having that conversation with your doctor and recognizing that we do know a lot more now than we did when we were talking about this a year ago.
Hmm.
Some staff, I think, have this kind of question, and I get it. We have done super, super well making sure that almost everyone who lives, say, in a group home type of setting with a developmental disability has had their vaccine. So why is there pressure, do you think, that staff should also be vaccinated, when people with disabilities in homes have that protection already? Why do you think it's so important for staff to also have the vaccine?
Well, I've been noticing uh, where I work, it's really difficult when there's a potential exposure to COVID-19 within the group home. So even if we're not worried about a very serious outbreak, which could still happen, right? The vaccine is not 100%. So even vaccinated people could become ill, which would be terrible for our residents. But anytime there's an exposure, a potential exposure, everyone has to go back into lockdown. And we know how that feels. It's so stressful, it's so terrible. And to see everyone now back in their rooms or not being able to visit with their family again, every time it's just so hard to do. And it happens because if you're unvaccinated, you're more likely to unfortunately catch COVID-19 or have a fever and not know where it's from. And so we are protecting our residents not only from serious illness and death, but also from loneliness, isolation, and all that too.
Yeah, and also, I mean, I say this as a family member myself as well. I mean, as families, I think we're just terrified of having, even if it's just 2 weeks in someone's room, the re-traumatizing of that having to happen again. The person doesn't know when they can't see their family. It's just for a short time. To them it might feel just like last time, which lasted forever,
Yeah,
right?
and it was
So
painful. It's very difficult. And I think even the staff don't like it,
mhm.
right? It's not the same type of interaction. Um, so having that vaccine is going to make a big difference in the lives of the people that you're caring for.
I think that's a really important to talk about what happens, if there is an exposure in the home. On the plus side, we are seeing this change in our province and in many provinces. When we think about things like vaccine passports or certificates, there are going to be more and more activities people can do in their community, and staff play such a critical role, I think, in helping those things to happen.
Right. And that's another consideration. That's actually something I hadn't thought about. But if the staff members don't have their vaccines, they won't be able to support people to go into some of those activities, right? Like going to certain restaurants or, the movies or different things like that.
And that is something that gives them joy, that also makes them happy when they're not going to those places, right? Like I think, and everyone I think embraces this who's chosen to work in this sector. We really want to help bring joy to people with developmental disabilities and help them live their healthiest, best lives. And we know, how terrible things have been for them. So it's that extra protection, but also ability to support them in the new activities that will gradually open up for them.
Yeah. And just, on a personal level, you're going to be on the front line. So whatever happens in the future with new variants or whatever is going on with COVID, being as protected as possible, because you're going to be expected to come out of your home and be at work. I think that's really important.
Yeah. Not everyone has a family doctor like you that they can talk to about some of these things. And I think that makes it, first of all, sometimes it's hard to find the time to do it, but also you may not have a trusting relationship with someone that you can talk through some of these things with. So I think that's a really important piece. There are some services that have opened up just to have these conversations. There's different groups you can contact, appointments you can make to have the conversations, but I think it's a really important piece.
Yeah, and I think it's good to seek out some of those opportunities for conversations. It's happening all the time, and sometimes I wonder if these groups make these meetings or videos and different things. Are we preaching to the choir? So maybe it's time to, if you have the questions, start looking for professionals that you can really ask them. Or even some of the vaccine clinics don't mind if you are just interested in asking a question, right, to the professionals that are there. Especially at this point in the pandemic, the clinics are busy, but they're not overrun, and they might not mind if you call and say you'd like to speak to someone. It's worth a try, right?
It's worth a shot. And I was going to say, if anyone is watching this video and they have questions, they don't feel like they have someone they can trust that they can go to, we can try to help find, tell us where you live, not your actual address, but, where's your community? And, we might know through different groups who can help have those kinds of safe conversations with you. So if you really can't find anything else, we have some resources we'll share with this video, but you can also reach out to us directly through.
Yeah, and you know what? I think the point of the conversation needs to be more about providing information for you so that you can make a decision, like a real informed decision. Because sometimes we get a little bit of information here, a little bit here and there, but we don't know the quality of the information. And we're all guilty of reading a headline and then internalizing that as fact without reading the whole thing or knowing or understanding the whole thing. So it's good to have that conversation with someone who's had the chance to delve a little bit deeper.
Yeah, 100%. I think the answer isn't, get the vaccine. The answer is have the information, have the information that helps you understand what's going on right now, recognizing that how we feel about something when we have certain information one day may be different than another day, that it's a process, but everyone has a right to good information and trusting, honest conversations.
And even if you feel like you know a lot about the vaccine from what you've read, you need to also understand your risk personally so that you can make an informed decision. And I don't know that everybody has that information. I think that's something that, like any average physician that you have a chance to talk to can tell you about. So it's important to get a chance to talk to someone.
Thank you so much, Dr. Niel, for talking with us today and giving us your wisdom. And I'm sure we're going to ask you questions again.
Hey, no problem. I'm happy to do it.
Okay, take care.